Well, today we're on location in North Charleston at the Coastal Vascular and Vein Center, talking today with Dr. Edward Morrison, who is a board-certified vascular surgeon, joining me today with some unbelievable news, a procedure that you just recently did right in this office, in your office here in North Charleston, that's never been done in the entire state of South Carolina.
Well, yes. We're utilizing a new balloon, a new therapy for blockage in the arteries, especially in the lower extremities, and it's a new balloon that has basically a chemotherapeutic agent that is drug-coated and treats the inside of the artery and has a much better result. That procedure has been done with coronary arteries for a good long while, and there is two corporations in this country with the technology. One of them has been done earlier, but we're the first one to do it in an outpatient center. Yes, sir.
And this is, you and I were talking minutes ago, drug-coated balloon.
Drug-coated, correct. Very interesting technology, Tom. We've been fooling with the artery in the leg for 25 years, and nobody knows exactly what to do. And that includes bypass, atherectomy, technologies to chill it, technologies to cut out plaque, stents of every variety, and we never had a perfect way to treat it. The newest technology utilizes a standard balloon that you'd put in a blood vessel and blow up, and that balloon has a chemotherapeutic agent, paclitaxel, which exudes into the artery wall and stays there for up to 180 days and reduces the body's response and the normal response of an artery to the trauma of balloon. So the results that have been seen out of the trials in Europe are astounding, looking at a one-year patency.
The trauma that is involved with surgery is paramount to how the patient's going to be able to react, and with the drug-coated balloon, the trauma is much less.
It is, and it's interesting. We do bypasses on arteries here, everywhere. We cut plaque out. We do all kind of things, and the Achilles heel of all arterial interventions has been the response of that artery wall to the trauma. What's it going to do? Because the God-given response, the God-given response is to scar up like a keloid. What this drug-coated balloon does is ameliorate the complex God-given cellular response. So you're not going to see this scarring and recurrent process in the artery. And that's our goal, to keep people free of disease and patency.
That is immediate. What about the effects down the line?
Effects down the line, and the first results we have are at a year, looking at trials versus drug-coated versus plain old balloon, and we're seeing almost a 30% difference at 1 year in patency of blood vessels, and that is 89% versus about 66%. So hopefully that will go out to 3 to 5 years, and some of the trials in the science research shows this chemotherapeutic agent is in that artery wall for up to 180 days, doing its effect.
Who is good, what type of patient is good for this type of technology?
We are treating more and more patients with lower extremity blood vessel disease, Tom, and that's in the leg arteries, and the thigh arteries, the femoral arteries, and it really has become epidemic in our population. And so those who cannot walk, those who basically say, I'm going to sit and do nothing, they're the ones at highest risk for atherosclerotic deterioration. To try to get that patient moving, to get an artery open, to get them moving and mobilized is our goal.
What are some of the symptoms of PAD, and exactly what is PAD? Sort of a short version of it, because you and I have been talking for an hour, and you know, it's just so interesting.
My mother, God love her, is asked, what does Edward do? She says, well, he's a vascular surgeon. But what is that? Well, veins and such. Atherosclerosis, heart of the arteries, is the #1 killer of the adult population. Everybody knows about the heart. The problem is, it's here, it's the heart, the aorta, gut arteries, lower extremity arteries. We take care of every artery in the body besides the heart. The cardiologists do that, and the heart surgeons. So we will see blood vessel blockage in basically every artery in the body. One of the most common ones is in your lower extremities, especially in folks who've smoked, okay? And so...
or still smoking.
Or still smoking. So that is a very common place for atherosclerotic plaque is in your leg arteries.
We've got a few seconds left. Your vein screening that's coming up.
Yes, sir.
Very soon. Tell us about that. It's a free vein screening.
Yes, we do a lot of screening, and this is a free service for the public. About 12 years ago, the treatment of venous disease revolutionized. Before that time, we didn't do anything because the surgeries were terrible. They were obliterating things. The ability to treat veins with minimally invasive technology, take the patients with swollen legs, edema, et cetera, and reduce it to make them functional it's been a big boost to the population here, and the outcomes have been very good. So we see a lot of patients with that.
And this is coming up Thursday, May the 7th.
Yes, sir.
Yes, sir. Dr. Morrison, always a pleasure.
Good, Tom. Thank you
yes,
for coming
sir.
by.
Always a pleasure. We've
Thank
got
you.
more coming up right after the break, so stay with us.